Welcome to the Trauma app. In this demonstration, I am going to document an adult trauma case, highlighting a number of key features to show you how to use the app in your hospital. The patient journey begins with the pre-alert information. The ED department at a major trauma centre receives a standby call informing them that an unknown female who is approximately 30 years of age has been hit by a lorry whilst crossing a busy main road approximately 2 hours ago. She was trapped under the lorry for a considerable amount of time until the fire services could extract her. She's been brought in via air ambulance. ETA is approximately 20 minutes. The patient is reported to be ventilated due to concerns about a serious head injury, in addition to concerns regarding abdominal bleeding, and she's also reported to have a right open fractured femur, tibia and fibula. Her respirations are reported to be 20, her saturations are 99% in oxygen. Her heart rate is reported to be 95 beats per minute. Her blood pressure is 93/52. GCS is 3. And she's been given IV morphine for pain. That is the standby screen complete. Whilst waiting for the patient to arrive, the team move on to the preparation section and begin to fill in the preparation checklist, ensuring that RSI drugs and airway equipment are ready for the patient, the ED consultant is present, along with the ultrasound analgesia. As the members of the team start to arrive, the Add Team Members screen is open. And here we can see that Alan, who's the trauma team leader, is present, along with Ben and Martin from anaesthetics. Betty, Leah and Dan are the ED nursing team, and Harry will be scribing the case. Steve and Stephanie will be conducting the primary survey as ED Doctor 1 and 2. And Phil, Tom and Macy are present from surgery, plastics and orthopaedics. And Mac has also attended from neurosurgery. All the team are now present and accounted for, and they're ready for the patient to arrive. Once the patient arrives in the ED department, the scribe moves the trauma app to the handover screen and immediately enters the patient's time of arrival. The patient's observations are as follows. Respiratory rate is 20. Oxygen saturations are 99% in oxygen. Heart rate is 97 beats per minute. Blood pressure is 91/50 and GCS remains at 3. The patient's temperature is 35.8 degrees. The team have informed us that the patient has a cannula in their right ACF, has received a dose of TXA, has a pelvic binder in situ, a femoral splint on the right leg, and a C-spine protection in place. The patient has also arrived on a scoop. That is the handover complete. The paramedic crew have been able to provide a history regarding the patient. The police were able to find some ID on the patient, who has now been identified as Sarah Smith. She is 32 years of age and her date of birth was the 1st of July 1992. Due to the patient being unconscious, the team are unable to provide a detailed ample history, therefore her allergies are unknown, medications are unknown, comorbidities are unknown, and also details regarding the time she last ate and drank. The events leading up to the trauma. The police have stated that Sarah was attempting to cross a busy main road away from a pedestrian crossing and was hit by an oncoming lorry at a speed of approximately 40 miles per hour. Whilst braking, the lorry appears to have dragged Sarah underneath the vehicle. That is the history section now complete. The team now begin the primary survey, starting with the catastrophic hemorrhage. Sarah does not appear to have any evidence of a catastrophic hemorrhage. However, her C-spine protection remains in place. Sarah is removed from the scoop. Moving on to A for airway. Sarah is intubated, therefore her airway is clear and the anaesthetist is happy that it is secure. The anaesthetist notes that Sarah's trachea appears central. Moving on to B for breathing. The ED registrar makes an assessment of Sarah's chest. She has air entry on the right lung and air entry on the left lung. There are no obvious signs of wounds or bruising on either side of the chest. Her oxygen saturations remain at 99%. Her respiratory rate is 20 breaths per minute. Her heart rate is 94 beats per minute, and her blood pressure is 89/50. Moving on to C for circulation. The surgical registrar completes an examination of Sarah's abdomen and is concerned it is very rigid. Due to Sarah being unconscious, he's unable to assess for any tenderness. However, there is central bruising across her abdomen. The nursing team assess Sarah's capillary refill time and find it is between 5 to 6 seconds, and therefore the trauma team leader requests that Sarah receives 10 ml per kilo of blood via the blood transfuser. They add 1 unit of O negative via the cannula she already has in situ, and it is administered now. The ED consultant requests another cannula is inserted. This was entered into Sarah's left ACF and was a size of 20 gauge. This is so that bloods including a blood glucose and a blood gas could be sent to the lab. Moving on to D for disability. Due to being intubated, Sarah's GCS remains at 3. A pupil exam is conducted. Her right pupil is reactive and pupils are size 6. However, her left pupil was sluggish and size 3. Due to this, the neurosurgeon requests that Sarah receives a dose of mannitol. And the ED trauma team leader also requests some imaging. He would like Sarah to have a CT of her head and neck, chest, abdomen and pelvis to identify any injuries. Moving on to E for exposure. Whilst the CT scanner is prepared, a quick examination of E identifies that Sarah has a deformity to her right femur, her right tibia and her right fibula. She also has several bruises and cuts on her arms and legs. Due to being unconscious, a log roll was not attempted, neither was a rectal exam. Her blood glucose is now back, which is 8.4, and her temperature is now 36.3. The team have now completed the primary survey. Based on the severity of Sarah's injuries, the trauma team leader decides to take Sarah urgently to CT, but reviews the summary tab of the trauma app beforehand. Here you can see a summary of Sarah's physiology, critical interventions, blood products and medications, and based on the last set of observations, states that Sarah is stable enough for transfer. Using the movement screen, the trauma team leader utilises the CT transfer checklist to make sure the transfer is safe. Once Sarah has arrived in CT, the time of arrival is recorded. Whilst in CT, the scribe is able to update the time the CT scan was performed and is able to update Sarah's observations. They enter her respiratory rate, her oxygen saturations, her blood pressure, her pulse rate, GCS, but they are unable to update her temperature due to her being on the CT scanner. Once the CT scan has been finished, the scribe is able to update the movement screen and record the time that Sarah returned to the ED department. On return to the ED department, and whilst waiting for the trauma hot report, the team decide to begin the secondary survey. The team identify that Sarah has several abrasions to her lower legs, some of them superficial, some of them appear deeper, and the team are concerned that they are grossly contaminated. The team also record the open fractures that Sarah has to her lower legs. This includes her femur, her tibia, and her fibula. The radiography team now contact the trauma team leader and inform them that the hot report is available. On the CT scan, it appears that Sarah has a spleen injury and also a liver injury, with evidence of bleeding. The general surgery team, based on this information, decide that Sarah must go to theatre for immediate surgery. With this in mind, the team prepare Sarah's admission, and the trauma team leader begins to review Sarah's report, ensuring that all the information has been captured correctly from pre-hospital through to the primary survey and any interventions. Sarah is then moved to theatre, and this is captured within the movement screen. And the trauma team leader hands over the case to the theatre team. The trauma team leader is now happy to discharge Sarah's case from the trauma app. All her case details have been inputted, and her disposition has been updated to state that she is now under the care of surgery. The trauma team leader enters their final notes. Sarah was discharged from the ED department to the care of the general surgery team. The trauma team leader is now ready to proceed to discharge the patient case. The trauma team leader reads and acknowledges the sign-off confirmation and then presses sign off. Sarah's case has now been discharged fully from the trauma app.